Hello and welcome everybody to our briefing today. This is just a brief webinar uh, discussing together the relevance of trauma-informed practice for our frontline staff and volunteers across all of our services who are working with children, young people and families in these complex and sometimes challenging times. What we recognise is that Covid-19 has had quite a big impact on how we have had to adapt to live every day. And what we know is that for some children, young people and families, that impact will be much more severe than others. We are, as systems leaders together, preparing ourselves for a surge in emotional and mental health needs for children and young people, and also for adults in our community. This is a really simple conversation in which we want to think together about what's the relevance of how we work with our children and our families in our communities, and how could trauma-informed practice help us with that. I've got with me today an esteemed colleague, Mina Fissel, who's very kindly offered to join us. Mina, do you want to introduce yourselves to everybody and let them know who you are and what you do?
So I'm Mina Fissel. I'm a child and adolescent psychiatrist. I work as an associate professor of child psychiatry at the Department of Psychiatry at the University of Oxford. And I also work at the Children's Hospital in Oxford in the psychological medicine service. Very interested in, I suppose, in services and how we can make services address the needs of our most vulnerable children.
Mina, it's really lovely to spend time with you, and thank you for giving up part of your day for this conversation. We really do appreciate it. We had a few questions we wanted to talk through together. So I think the first one is probably, would you tell us a little bit about the principles of trauma-informed practice?
So I think we've learned a lot in the last 20 years about the really long-term toxic effects that children who are exposed to multiple traumatic events, how that then affects their lives, not only in childhood, but also throughout the whole life course. So trauma-informed practice is a term that's been used. There are lots of different kind of descriptions of it. Trauma-informed practice is one of them. Really thinking about how actually when a child has experienced difficulties and adversities, that actually we need to think just beyond an individual treatment for that child, but to think about the whole system and how we as systems address these problems, not only for that child, but for their whole family, maybe for the school system, maybe how we as professionals work together to best manage the strengths of that child as well as the difficulties. And so it's about thinking about the impact of trauma and how we should learn to work in a way that respects that and addresses what we know are likely impacts of that.
Thank you, Mina. So if we were using a trauma-informed practice methodology, how would that change our response to a child or young person who was experiencing trauma? What would we do differently?
Well, I suppose at the core of it is just a little bit more empathy. Like, it's not saying that we don't have empathy, but I suppose when you really learn about the different types of trauma that children could be exposed to, and then really try and put yourself in that child's shoes and think, what does that mean for how they then might behave, and also how they might then accept care, then I think we do change a lot of what we might do. So to be kind of more specific, I think it means that first of all, we just have a little bit of an understanding of what this can mean. So a lot of this comes from the work around adverse childhood experiences, or what we call ACEs. And there are about 10 of those that have been listed that fall under kind of abuse, fall under neglect, and then fall under kind of family dysfunction. And that's not difficult to read about or learn about, but actually to sit and think, what is it like for a child to be physically abused, emotionally neglected, and be witnessing domestic violence in their home? And how does that make them think about authority at school and the reality of being able to access support, and what their family might say about that, and whether that might exacerbate their difficulties? So a trauma-informed approach would be something that kind of, from our children, we'd understand how trauma might be expressed. we would screen for it regularly, we'd think about it, we'd think about the best ways to provide services to make them acceptable for the children, to have resources available, and also as services we'd be working much more closely together, sharing information, sharing knowledge, so that families don't have to repeat themselves, so that kids don't need to say things again, so that we all keep ourselves abreast of what is best for that child. So it's kind of finding meaningful ways to think about the child, think about the family, think about the system, and then think about how we work together, all to kind of address the trauma, because in a way this is a particularly vulnerable group of people who aren't necessarily going to find accessing care easy.
Thank you. So it's really thinking about the load that our children and young people may be carrying when they walk into our environments, that hidden load. We know how high domestic abuse rate is at the moment, particularly the impact that's having on our children and young people, those kind of stresses that they bring with them as we then interact with them, and bringing that empathy in our interactions with them, the sense of calm, perhaps a sense of safety, feels very important there.
You know, I often reflect on, me as a practitioner, I'm just so busy, and, I want to see people and then discharge them so I can see the next person on this very, very long waiting list. And that model can be really complicated for these kids, where you offer them an appointment, they don't turn up. You phone, you speak to them, they say they'll come to the next appointment, they don't turn up, and you just kind of go, right, well, we've done everything we can, now let's move on to the next kid on the waiting list who won't, instead of thinking, my gosh, what are the barriers to being able to step into the door, to be able to get care, to be able to trust people in authority. It would completely change the way that we work, really.
Yeah, that's so important. And when you're using a trauma-informed approach with children, young people and families, what kind of difference do you see? What difference does it make to that child, Mina?
Well, it's long, hard, difficult work. This isn't a quick fix often. So first, to be aware of that. And I think the difference is that you just enable them to build a trusting relationship with you, and an understanding that that might take longer, and that you might need to use other people in the system. So I often talk to schools about, whether or not you want to play a key role in the mental health support of these kids. You might be the only adult that this child is going to find acceptable to be able to get that initial help. And so I think for children, it's about helping them access care, that they're not going to be able to come to a complete stranger in a completely alien building and tell them about some of the hardest things going on in their lives. So for a kid, the difference will be that we might provide services and care in a more familiar setting, for example, at school, with individuals whom they might already be familiar with, also present, helping them. And it kind of makes sense, doesn't it? They're going to find that far more trusting and empowering and enabling.
So that ability to create places of safety by building on relationships of trust, and places that feel calm and manageable and familiar for our children.
Yeah.
Brilliant.
And also, they might not get this opportunity again. So, we're busy, we can't manage it, there's too much else to do. But for this child, this might be that only opportunity that can make such a massive difference in their life. So we're just to be aware of the preciousness, I suppose, of those opportunities, and not to think that someone else in another classroom or in another school or in another service might be able to pick up on it. That might not be the case.
That's really powerful. Thank you. As we are thinking about schools, in your experience, Mina, how has trauma-informed approach made a difference to schools, and how could that be useful now as we prepare for what we would describe as a recovery phase, a restoration phase following COVID-19?
So I think we've been able to experiment quite a lot in Oxfordshire schools over the last 2 decades that I've been working in mental health services, but with a particular interest in schools. So I started working with refugee populations, and then we moved to all children at schools and finding ways to bring mental health services into schools. And what we see is when we're able to do that kind of work, where we as mental health services go into the relatively safe environment of a school, it's much more familiar and often feels more safe to the majority of children than a clinic, for example.
Mm-hmm.
We find that actually the first thing that is very striking is many more children need your help than are being referred to services. Yeah. So that's the first really important thing, that once schools kind of open their doors to more services coming in, to working collaboratively with those services, actually it enables the environment to then support more children to seek care. So I think the first thing is that you are able to access many more children who aren't accessing you already and do need a lot of help. What you see is kind of these systems working closer together, so schools feeling empowered. You know, often schools are dealing with unbelievable complexity, and they sometimes don't ever refer to mental health services because they're worried that there's such a long waiting list and the child won't ever get seen. So schools manage and hold on, and then by the time they refer to services, it's like a complete and utter emergency because they've been managing it for so long. And what we hope, and we've started to see with the kind of better relationship with mental health services in schools, is that things are addressed and discussed early, that schools feel happier to manage certain things because they know that we're around and nearby and we'll support them if it gets more difficult. But also we're able to have that conversation where it's like, actually, school, you know, I think we need to see this child sooner, so why don't we see them rather than you hold on to them. So you see much better collaboration, much better ability to help each other. And actually, I feel schools are much better able to do what they do really well, which is support and contain and guide and nurture children, knowing that they've got a bit more support from mental health services as well, that they're not out on a limb on their own.
So there's a number of layers in what you've said, aren't there? There's, for some of our schools, they'll have mental health support team workers, mental health workers working alongside their school teaching staff and pastoral staff. For other schools, they'll be wanting to build a close relationship with colleagues like yourself in CAMS, so in child adolescent mental health services, or over the phone perhaps, kind of providing that advice and approach to create those places of safety for children where empathy is our kind of key currency, to understand where that child is, where they've been, what they carry. And we recognise, don't we, that across the southeast you've got an excellent setup in Oxfordshire. It may not look the same everywhere, but the principles of what you're describing carry across. Is that right?
Yes, you know, so it takes a little bit of commitment of time and resources. Our commissioners took that leap, I suppose, initially and thought, let's try this, which opened the door, I think, to a lot more resource coming in. And so, you know, I can understand the struggle of some schools where it's difficult to access services, it's difficult to speak to someone, it's difficult to do that. But I think just, you know, let's have these higher level discussions as well. So even though you're a school that can't talk to CAMS, you can actually talk to other parts of the system, for example, commissioners or local authority, and say, we actually want to be doing more of this. We want to work more closely. We want to provide some resources to CAMS that they can see some of their kids at the school if that helps them. And from that, you know, relationship, we'll be able to build a better structure to help the young people in our schools. So I think it's a process of starting to talk and think about solutions and ways to help all these systems work together. That's the way it's going. There's no way we can work in isolation anymore. More and more people in services realize that, you know, we just have to be kind of co-located a little bit more. And so even if that isn't happening where you are, I think start that process. For me, I think honestly, it was a 10-year process. So, you know, hopefully it won't be as long for everyone else. But, you know, this is something that, you know, you snap your finger and it works. This is something where you just build, you do, and then eventually there's something, hopefully, that's really useful.
So head teacher colleagues, we are inviting you, talk with us, talk with your local authorities, CCGs, NHS England and your CAMS providers about what's possible. How might we do this together? Mina, that's so helpful. As we kind of cast our eyes even wider We know that we have a number of colleagues in voluntary, community, face sector provisions, in general practice, in early help, who also would benefit from thinking about being more trauma informed in their practice. What would you say to them?
Well, often actually, you play such a key role. You are probably the individuals on the ground who have the relationships with these children that we're most worried about and concerned about. And actually, you know, that is incredibly important. So to say, we in services are trying to work much more with third sector organisations across the board, and so also to be part of that conversation, but not to underestimate the importance of the role, to try and get as much learning and understanding about the impact of trauma, what you can do, how you can help these young people. And given, this very strange time, as you mentioned, this lockdown period and the repercussions of COVID-19 on all of the way we work, there's a lot more resource out there online that we can learn about. So there's always an opportunity to inform yourself as a first step, as we learn how best to coordinate amongst organisations.
So, Mina, one of the key questions for us to think about together is that for some children, they will be experiencing the impact of trauma for a short time. And for other children, we'll see severe or enduring mental health needs starting to develop, or we'll spot the signs of things like PTSD, for example. How would you advise all of our multi-professional staff and volunteers to look out for the indicators of the things that would cause us to worry more? And if they spot those things, what do you advise that they do next?
Yeah, this is really important, and a question that everyone grapples with: teachers, third sector organisations, primary care. So don't worry if you don't know which kids to refer and which kids not to. That's just
Yes.
kind of the art of it and the complexity of it. So the reality is that we don't want to over pathologize. We know that this period of COVID-19 lockdown and the pandemic is really, really complicated for a lot of children. Some children will be more anxious, more depressed, more withdrawn, or the total opposite, and I suppose some of that is going to be expected, and we don't have to knee-jerk refer everybody that we're worried about to services. What I recommend doing usually is, for example, if this is a kid at school, I would just observe them in every domain that's available to me. So one is what they're telling you. The other is how they're performing in class with their academic work and their homework. The other is to see what they're like with their friends and other peers, both in the structured classroom setting and the unstructured break and mealtime settings. And I would look at all of those areas. And if they're telling you they're not coping, but actually your objective observation is they are managing their work and they are interacting with their friends in a similar way, I would be less inclined to just rush in and get more external support. I would just do what I can to build the internal structures to keep them feeling a sense of well-being, self-esteem, belonging at school, encouraging them to go to whatever things they used to always go to, and I would watch them. But if they're starting to kind of not attend school or not given their work, or for it to be of a very different quality, and for this to be sustained over a few weeks and to be more withdrawn from their friends, those are always more concerning signs for me. So I would just look at all those areas and then just see what is the pattern. And actually, if it's going awry in all of those indicators, then I would do it. The other area I would do is I would actually really look at the ACEs. So, I'm more and more less inclined to give universal interventions for young people. I'm really more inclined to really target. So, if you've got a child who the parents have separated and it's been a difficult separation, if you know that they've got a parent with a physical or mental health problem, if you know that, they've, might have had some evidence of emotional neglect in the past, then actually you have a totally different way of approaching that child to one that doesn't have those underlying risk factors. So I think we can have a nuanced approach to children. I think you know, whoever you are working with children, you need to understand where that child is coming from. If they've got those risk factors, you don't need to talk to them about their risk factors. You just need to be aware that these are the type of children that you want to be a little bit more aware of their needs, but not to underestimate that their need might be that you help them build their social network. You know, their need might be that they're told that they just really have to go to football practice this week, that the team needs them. You know, things that, you know, you don't need a formal mental health intervention to help the mental health of these children. You need to think about the breadth of needs and skills and structures available, all of which will play a part in supporting them. But if things are bad and you are worried, then, you know, I would encourage early discussion with mental health services. More and more services are available with telephone advice, and that's what I would go for first. I would see if there is a phone advice line, or some services call as a single point of access, and, you know, relatively early have a discussion and see.
That's so powerful, Mina. Thank you. So what you're describing, I think, is look at the whole person. Look at them in every space that you see them operate, both the formal and the informal. Balance what they say about how they feel with what they are able to do. And look at, are there significant changes over a period of time that you notice, having known them for a little while? And then your key point is, you know, these worries, the things we are concerned about, are balanced by offering places where the best in somebody can be captured. Yes. So the protective factors, the things we enjoy, creating spaces where everyone is valued and welcomed and cared for matters, doesn't it? But if you're unsure of that opportunity to seek advice, we're running crisis lines everywhere, aren't we? 24/7, 24 hours a day, 7 days a week. Ring, ask for that support, ask for that advice. That's brilliant.
Can I say one more thing?
Yeah,
like,
please do.
obviously I am a researcher as well, so I do think, you know, there do draw on the evidence. There's a lot of things out there. You know, let's really understand which are the best things to do, and also don't be scared to try and assess what you do. So to evaluate, you know, and to look at, you know, what you think, if you're going to try something, what you think it'll do, and then really see whether it is done there. And in Oxfordshire, Berkshire, Wiltshire, South Gloucestershire, we're running a school survey, so schools can use this. Their pupils can log in from home and fill out quite a detailed questionnaire that takes about half an hour. And we're able to really then, the schools are then able to access all of that data to really learn what's happening in their schools. So these are things that are available to actually inform yourselves of the evidence, be that what is actually going on with the kids in my school right now. Well, that's being run through the University of Oxford, for example. The schools in these areas can all sign up. It's free, and you are then able to access that data. So really get evidence on what's going on in your school, and we can help that. Get evidence on what you're thinking you might do before you just run in and offer any old thing. And then if you are doing something, think of ways to evaluate it, and we can kind of help with that. So given how many kids are at school, we know so little about what works and what doesn't work, and it's just unacceptable. So I think we all have to do something to contribute in building that evidence base.
So Mina, if I was a head teacher talking with you now, I would absolutely be taking you up on the survey for sure. But I would also be saying to you, where do I go to look for evidence-based practice for my school? Similarly, if I'm leading a voluntary or a community or a faith sector group, I'd like to know where to go to have a look for what does that mean for my practice. Is there anything you want to recommend?
So there are a lot of resources out there. I think there's a real need to collate this properly. So education does this really well with educational interventions, but there's no correlate for mental health intervention. So I think the first thing you should do is complain that there isn't. Sorry. Then I would just talk to your local authorities, because actually the local authorities have put a lot of thought into what is being offered in each area. Have built resources and capacity, and it's slightly different in each area. It doesn't mean one's right or one's wrong, it's just nuanced available. And before you go to an external kind of organisation that just comes to you, first see what's available and being promoted by the organisations that are actually there to do that work. So that's what I would do first. I'd have that discussion. And then if you want to try something, well, just kind of ask them what's the evidence and, think about, keep your critical head on and make sure this is the right thing.
Brilliant. So in the absence of a national list, we have pulled together a few resources that we know have helped many. We can't formally endorse them, but we can signpost to them. And we will show that information after this conversation. Mina, on behalf of us all, can I thank you for your time today? It's been really good to speak with you. And thank you for sharing both your experience and your empathetic insight.
Yeah. Good luck, everyone.